Hello, this is Dr. Gary from First Look MRI, and this is a 15-year-old male who injured himself playing baseball a couple months ago. He got continued pain in the left hip, and the left hip looks very good on this MRI. But he does have another finding which is related to his ilium. This big bone here is the ilium. It has a cup area here called the acetabulum. The femoral head rotates in this cup for the hip joint. If we come up here, it has another joint here. This is the left SI joint, sacrum, ilium, this SI joint. And if we follow it up here to the very top, we have the iliac crest. And if we go forward, we get into the anterior margin. And where the anterior margin of the iliac bone is here, we see this asymmetry, a bright signal here, marrow edema. Here's the right side looking normal. This is the abnormal left side. So this is where he's experiences pain. He said hip pain, but really it's above the hip here in the front. And this is what we call the anterior superior iliac spine. And there's the inguinal ligament attaches here, also the sartorius, intensor fasciolata muscles, tendons attach up here, and these things can tug on this and cause reactive marrow edema. We call this apophysitis. This is a sagittal view looking from the side. We see the hip joint looking great. And if we follow this up, we see a little bony protuberance here. This is the anterior inferior iliac spine. This is where the rectus femoris attaches there. But if we go up higher, we see the anterior superior iliac spine. We see that that growth plate is not completely fused. And so that constant distractive tugging motion on there, or just a big injury, can sometimes cause that growth plate to become irritated or inflamed, and we call this again apophysitis. Sometimes this can yank off, and this whole piece of bone here, the apophysis, can break off and float away. We call that an apophysial avulsion, but this is not displaced, just marrow edema, and that is what's causing their pain. And we can look at this from a different angle here. This is called an axial view. You can see the right hip, we see the left hip here. As we go up, 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 we're going to get into this ilium, and we can see that marrow edema on the left, not on the right. And there it is. So there's the marrow edema along the front, and this is a case of apophysitis involving the left anterior superior iliac spine. And again, there's no avulsion at this time. Thank you very much.